Good afternoon. I'm Patty Hayes. I'm the Chief Consultant for Women Veterans Health at the VA here in VA Central Office. And I was so pleased today to be asked, after a lot of years working in the VA, to be asked to be here today to talk with our women veterans who've volunteered to come forth and talk a little bit about their perceptions of VA and their health care in the VA. I say volunteered with some emphasis because women always have volunteered for every conflict, for every role in the military. Women have always volunteered. So we're volunteering you here today. So I'm going to have you go ahead and introduce yourselves. Go ahead now in order and tell us a little bit about yourself and what brings you here.
Okay. Good morning or good afternoon. My name is Amelia Poling. I am an Army reservist. I have deployed 3 times, twice to Iraq in 2005 to 2006 and again to 2007 to 2008. And then recently to Afghanistan in 2011 to 2012. So I'm married, I have a dog, and I'm very excited to be here and just talk with everybody.
That's great. Natasha.
Hi, my name is Natasha Espinosa. I am Army retired, medically retired in 2006 officially. I was in Iraq, sustained injuries there due to an IED explosion, and have been using the VA healthcare since then. And I have a daughter and 2 dogs.
Hi, I'm Danielle Carraza, and I am an Army veteran. I served for 5 years and got out in 2002, which makes me feel a little bit old up here. I've been using the VA since then, and I've had the privilege of using many VA programs, including Voc Rehab and GI Bill, and most recently the VA healthcare.
Great. One of the things I wanted to talk about was the fact that women don't often identify as veterans, and we think of that as sort of a barrier. I wonder, Danielle, do you have some ideas about what that might be about?
I actually have a funny story. So part of my work in the last several years has kind of been to come to panels and come to events and talk about being a woman veteran. You'll notice I wear my little pin so that people specifically ask me if I'm a veteran, because I think frequently, especially with the younger generation, we don't get recognized. And we had a big VA event, and so I called my mom and I said, "Mom, why don't you come up and meet my women vet friends, and you're a woman vet, and it'll be great." And she said, "Well, I'm not a veteran." I said, "Mom, we're from Camp Lejeune, and you served 5 years on active duty, including a deployment. I think you're a veteran, pretty sure." And she said, no, I didn't get the 5-point government hiring preference, because she served during a specific period that wasn't eligible for that. And for that reason, she'd never registered with the VA, and she had no idea that she was a veteran. And so this was a huge realization to me that the barriers actually do exist, and that there are women that really don't believe that they count. And so, of course, I rectified the situation, and she is registered now, but it was a personal kind of reminder that we can't take it for granted.
Well, yeah, that's totally crazy because, I was just reading something. It was there's something like 2.2 million female veterans,
Yeah.
and only a quarter of those veterans are actually using VA healthcare services.
Well, and even less are registered at the Women's Memorial. I think they only have 300,000, and so it's sad because we will lose our history, and then if people don't step forward.
And we're the fastest growing population,
So how can we let women veterans know? One of the things that comes up is talking with folks about asking, did you serve in the armed forces, rather than are you a veteran? Your mother didn't know that she was a veteran. Women veterans sometimes think that you have to have been in combat or you had to have been injured while in the military before you could use VA services and benefits. But some of those of you coming along now seem to understand that you serve side by side, you are a veteran. I have a big barrier to overcome, though. Have you had any of that experience with other veterans? Maybe Natasha, have you run into folks who didn't know they could use VA?
I've run into a host of different types of people. Mainly, though, it's been those people that just are afraid to go into the VA. They just don't think that they fit the demographic for the VA. That's both male and female, though. It's not just one demographic. But yeah, I think a lot of people just don't identify with the veteran population, or at least the idea of what they think the veteran population is, and that's unfortunate. But we're gradually changing that the more we get people in.
Well, it definitely starts with things like events like this where we can, talk. Full disclosure, I'm not currently enrolled in VA healthcare, so I'm here, as one of those female veterans that just aren't using, VA healthcare, and so it's one of those things where we have to, I'm an Army reservist, so it's difficult to know whether or not am I even a veteran? Do I even qualify for these services? I'm still serving, but does that mean that I can, come in and get health care?
And that seems to lead to one of the big questions. How do you navigate it? How do you figure out? I mean, you may well be classified as a veteran now, I don't know, without some of our eligibility questions, but
Right.
that seems to be a big issue, navigating the VA.
It's definitely very hard. I mean, you go onto the website and there's a lot of information up there. You have to, kind of dig through all of that, and then, some of the eligibility questions, just can be a little confusing. It's just,
So we're going to talk some today about the site explore.va.gov so that people can learn that there is a one-stop place to go. But I think even talking a little bit more about these issues about eligibility and the confusion.
Well, I was going to say, so I've been using VA for a long time, and when you use Voc Rehab, a lot of people don't know, one of the benefits to using that over GI Bill is that your health care is completely covered while you're in the Voc Rehab program, and so as an unemployed student, that was really beneficial to me. I actually found out more about the priority groups and the eligibility because the Women Vet Call Center called me. And they said, hi, we're calling for, Ms. Carraza. And I was like, can I help you? It said VA. And they were very helpful. They went through the eligibility requirements, and they actually gave me information about some of the copays and the deductibles and the caps on those that I didn't know. And so it actually was more cost effective for me to transfer some of my care to VA from my civilian healthcare provider. And again, I'd been using VA for 8 or 9 years at that point and had no idea. So I think the VA call center is doing a great job. I'll go ahead and plug the number is 855 VA Women. They answer the phone, and it's 50% of the people, it's all women, and 50% of the reps, if not more, are actual women veterans. And so you don't get a lot of, I didn't have anybody say, well, I don't know, or I'm not sure. They were very responsive. They called me back. They followed up after a 30-day window. And so that was a huge resource. And then they directed me where to go on the website because, yes, eBenefits is phenomenal, but it is intricate. And Explore VA makes it a little less intimidating. But I think if you don't know what questions to ask, it can be a lot to go on the website and just start clicking through.
I agree. I totally agree with you. When I first went on the website and just started clicking through, I was completely overwhelmed. And that's not that it wasn't set up the right way, but there are so many resources available in the VA that it's easy to get logged into one tab and then kind of shift into something else and sort of think you know where you're going. It's kind of easy to do that. So yeah, I would say call into the hotline and get as much information as you can from someone who knows it and can direct you through that.
And one of the nice things about the hotline is they can actually sign you up for your benefits over the phone and direct you to your nearest health care. And so the 855 VA Women, it sounds like we're plugging it, but we set it up because we knew there were so many women who don't use VA. It's actually only about 17% of all women veterans actually use VA. And we want women who've earned these services to be able to use them. If we can get them all right,
Okay, guys, I'll sign up.
That wasn't our goal today, Amelia, was to get you to sign up. But we just want everyone who might want those benefits, we encourage everyone, even if you don't want to use it right now, to get into VA and get yourself registered so that you could use it if something really catastrophic happened to you.
And it isn't just about, in my opinion, I don't think it's just about signing up for, what happens later on, or what might happen, but actually to start making that, putting in that history. What is that called?
Yeah, so more of a baseline medical history.
Right.
I've been in 3 different VA medical systems. I went from Kentucky to North Carolina to DC, and I was surprised recently when my doctor said, "Oh yeah, look here in your record, you went to see a doctor in Fayetteville," and I said, "I did." yeah, don't you remember this? No, oh, that was 17 years ago. Okay, sure I do. But it was very helpful to have because it had created this service history, and they were able to adapt my current treatment based on some of my past lab results. And so it kind of shortcutted having to go back through all of that work.
Absolutely. I did the same thing when I switched providers. My provider really, even though they knew me very well in my VA, because I've gone to my VA for an extended period of time, there was a period that I moved for work to another city in the same state, but still I moved actually to a couple of different cities for work, and I was going to different VAs, and then I came back and I said, I know, I've seen someone for, I just know I have, and you know what? I wasn't really sure what happened. I have a horrible memory, but my records were there, and so we were able to go in and say, okay, this is what happened, this is what you've done, and it was very, very useful. So it was a good.
Well, I think people don't realize that that option doesn't actually exist in the civilian healthcare network as of now. So I have some civilian providers, they don't talk to each other. They don't have a main base infrastructure that allows them to access records from other visits or other facilities. And so kind of having the central location has been extremely beneficial in maintaining that.
Natasha, you can tell us a little bit more about what your health care actually has been like in the VA, and what are some of the things that you've gone through?
Okay. Well, my health care in the VA has been, well, let me just say that I don't have very much, if any, civilian health care history. I went into the military very young, so I started my health care services in the Army, and then I immediately transitioned to the VA healthcare system. So I can't really say, I can say that I have had some, and my civilian doctors that I have had where okay, so my VA doctor,
You don't have to give away secrets.
no, but my VA experience has been good. I honestly don't have anything negative. I have very little negative to say about the VA, simply because I think that I came in at a time where we were really pushing for change in my local VA, and I lucked up, I guess. I can't say that that's going to be the same experience for everyone, but I have had really good treatment in my VA system. I haven't had, if there was ever a cause for concern, it was immediately addressed, and we move forward. That is not going to be everyone's experience. And so don't let me sit here and say that rah VA, all that stuff, because that's just not the case. But what I can say, though, is that the VA is really making some dynamic changes. They have since I've been in the VA. I've been in the VA now. I actually started going to the VA in 2004. So I've been in the VA now a little over 11 years-ish, something like that. And I've had one, maybe two bad experiences, and everything else has been really phenomenal in my case. So.
You want to talk a little bit about some of your experiences?
I can. I mean, there's a lot of, I think, negative perceptions out there about the VA and about the healthcare that you would receive going through there. So for me, it's, that's definitely a barrier or a challenge that I have to overcome. Mentally, it's just, am I putting myself in harm's way, or, am I going to get the best healthcare that I possibly can through the VA, as opposed to a civilian provider. So, it's really positive to hear, people that have had great experiences with the VA. And what did you say? 98% of your
98%
are positive
experiences.
Yeah.
Well, and I'll jump in and say that I think we undervalue the subject matter expertise of some of the VA doctors.
That's totally true.
My civilian doctors maybe have one or two veteran patients, and I'm lucky if I am, I in most cases am their only woman vet patient. And so when you go to the VA, they've seen hundreds of women like me, or veterans with my service-connected disabilities, and so they are able to access that wealth of information that the civilian providers just don't, they just don't see that many cases.
Not just that, though. There is an understanding that the VA doctors have that civilian doctors just don't have. It's an innate ability to recognize what someone is going through. They know the history. They know people who have been where you've been. Sometimes, most times, they have been where you've been. So it's so much easier to communicate with VA doctors than it is with civilians.
Well, and we were talking earlier, sometimes the VA doctors will catch something because of something that you say that civilian doctors won't say. And I think you were saying there was back injuries, and I have a friend who carried a weapon on her hip for 3 years, and it caused her to have some pain and dysplasia. And her civilian provider said, well, you're just getting old, you're fine. But when she went to the VA, they said, no, this is a common injury, and we can correct it, we can prescribe physical therapy, and we have supportive services to help you overcome this. It's a very common ailment, and so she was finally relieved of her pain after civilian doctors had told her, for years, this is idiopathic. And I don't know how many of you use the healthcare system frequently, but to be told something is idiopathic, which means it has no cause, is one of the most frustrating things ever, because it's pretty much saying, suck it up and live with it.
Or it's all in your head.
Or it's all in your head.
Yeah.
And
we don't really believe that you have this. And I think you're picking up on something that, as VA providers, we've really been trying hard to do, which is to understand the effects of military service on veterans' lives and to understand how healthcare needs to be different or what are some of the things that folks go through in the military and how that affects your health. And we certainly do things. I think I didn't really completely understand some of the issues about neck pain and back pain until we started bringing folks from the military to our trainings, and we try on the vests and we try on the gear. And I never put the whole gear on because I think my neck would hurt too much. And I'm thinking 24/7 with the gun, the rifle, and the helmet and everything. It's really an amazing amount of weight to carry, and then to jump off a truck, or to do something else. And I know that you totally get it, but to have doctors who go through that, we have pictures of them. We should have brought some to show you them trying on the gear, because it's important for them to totally understand that. And we try and train that. We also try and train some of the private providers now.
Yep.
I wanted to jump in and say that I think another barrier that I have encountered, and I think Amelia and I have talked about this, is the hurry up and wait mentality. Well, I'm going to go to VA and I'm going to waste my time and I'm going to be there all day and it's not going to be beneficial to me because it's just going to sit around.
I
will
have
say
8 hours
I don't
to
have
go to a
8 hours.
doctor's
Right.
appointment.
And I have had days at VA like that. In 15 years, I can honestly say that especially the DC VAMC has come a long way. But what people don't realize that once you are enrolled and you have that ID card and you've started that history and you get into e-benefits, you can refill your prescriptions, you can make appointments. They have this fantastic tool called secure messaging. You can send your doctors a note and they get right back to you. And if they don't have an answer, they say, well, call this number because they'll have an answer. I recently had my first telehealth appointment. I had a question about a medication and the doctor said, I can't answer this over secure messaging, but I have an appointment tomorrow morning at 9. Can I call you on this number? And I said, okay, yeah, sure, no problem. And expecting I'll just be put into a queue or it would be an automated dialer. And it was the doctor. And she said, I have 25 minutes to talk to you. How can I help you? And she adjusted the prescription and it showed up at my house five days later. I think it's 5 business days. So these are value adds that the VA offers that none of my civilian providers offer. I mean, they want you to come into the office so they can charge you that $35 copay. And so as far as being time consuming, it can be getting started, but once you're in the system, I mean, the benefits are extraordinary, and being able to download the service history and take it to a civilian provider if you need a specialty has also been quite useful.
I think VA has stepped it up some about these electronic issues and FaceTime kinds of telehealth. And unfortunately, it's not always available everywhere, but
Right.
when it works right, it's really beginning to work very well for veterans. We like people to be able to, because I think in the past, VA was built for 70-year-old guys who like to go to the VA for the day and have lunch in the canteen and make
There's
a day
still a
of it.
couple of those.
You've seen it, but that doesn't work for someone who's working, and you can't waste all those hours when you're working, and oftentimes don't get paid when you go away from the office to get to the hospital for the medical appointment.
Well, and having, from a kid's perspective, I haven't had the luxury of testing out a childcare pilot, but Natasha tells me that the VA pilot is phenomenal in Dallas.
It is. It is. And that's something new that's coming into play. And it's been great. I mean, really, when you can go, I have a 4-year-old, I think I told you guys before, and I would never, I missed so many appointments because I was like, where am I going to leave her for a day? This is
Right.
before she was in school. Or what am I going to do with her? She can't come into the doctor's appointment with me. She doesn't want to sit around with all these people that she doesn't know. I mean, and so being able to just take her and drop her off, once they're enrolled in this pilot program that's going on, they take them, drop them off, go on about your business, and then come back, and she's had a great day, and I've had a productive one, and we can go home and get back to business as usual. That is very, very good and beneficial, and so hopefully that's something that we can expand.
All right, Dr. Hayes, what do we have to do to get it to DC?
Well, VA has.
And the rest of the veterans that need it in the country.
Right. Well, we know that it's very important for the veterans who can use it, and right now it's on the plate for Congress. It's something that we need a law to be able to expand childcare to the other VA sites. So
So write your congressman. Or
it's
woman.
something that you can work with your representative and congresspeople about. Yeah. Well, we talk a little bit about quality, and one of the things that's a struggle for me is to let people know that we actually do have high-quality care. And I didn't think we talked about this before, but it may surprise you to know that VA actually leads the nation in all the things we can measure about health care for women. For example, pap smears and mammograms. for 15 years, we've done better than any insurance company. We do better than Medicaid and Medicare. And, you know, I'm tooting my own horn right now, but it's really hard when we think about hearing that we know there are veterans who think the VA is terrible. Why would I ever go there? It's dangerous to go there for my care. And so there's this gap between what we can do and the word that's out there. And you have any thoughts about that? You're one of those that probably thinks we're not doing so well.
A little scared. No. But I was, trying to prepare myself for this, come in with, at least some information. And the VA is investing a significant amount of money in healthcare for women veterans, right? Mm-hmm. So we're one of the fastest growing populations for the VA.
Right.
That's all correct, right? So there's female health centers, right, or vet centers for women, and then there's also, are there gynos at each VA yet?
But that's
I know
something
that
that
was
we
a
could
big
ask
I
problem.
have a personal story on that one. So I recently switched into the women's clinic because I firmly believe it is if you build it, they will come scenario, and I think it's our responsibility to test and use all programs that are available. So they asked me if I wanted to switch into the women's clinic, and I said sure, and I was going in, I have service disability for my feet, and the doctor, I was just saying, oh, how are you? It's nice to meet you as a female. And she had switched from family care. And as she was kind of scrolling through my record, she said, well, I see it's been a couple of years since you've had your, parts examined. And I said, oh, really? I didn't know that. And she said, oh, we can go ahead and take care of that today. We can do all the testing and we'll get the results right back to you. So I was a 1-2 punch for me. I didn't have to make a separate appointment elsewhere. But I was surprised at how accurate and how quick and effective they were. And she'd been doing family medicine for 20 years, so she was very knowledgeable, professional.
We want folks who are skilled and interested in seeing women. So we have what we call designated women's health providers, and that's not really available outside the VA. We're doing something different than's done anywhere else because we're trying to make it very skillful, but also convenient. And so what we know is that a general primary care provider who's well-trained can take care of everything from birth control to pelvic exams to talking to you about everything else in your life and smoking and things like that. And that gynecologists really are surgeons who are trained to take care of things like an abnormal pap. Now, some people get confused because a woman coming into the VA can see a gynecologist if she wants to. We never say, no, you can only see a primary care provider. You saw a primary care provider in women's health. So what we found by doing a lot of research is that our women actually like this better. And yet we still have the challenge of making sure we have so many women coming in that we have gynecologists. So we actually have gynecologists on site at all but 35 of our hospitals, and we're working to bring those others online because we think it's really important to have. But for all of the care of women, so that you come into the emergency room, there'd be a gynecologist who could take care of your abnormal bleeding. But day to day, you can talk to your provider and say, I need my birth control renewed, or I need it, So it's a different kind of system, and we realize sometimes that's hard to explain to people.
Right.
Why wouldn't I always have an OBGYN to see? Well, if you want one, you got one. But if you'd rather put all your visit in one stop with somebody
nice.
you know well, we have that too.
Like, cross that off the list. Next.
I don't know if I do it the first time I met somebody.
She was really lovely.
Yeah.
I was surprised.
So she made you
but
comfortable, and that's what's important.
She was very comforting. And her history, she kind of took the time to explain to me, I've been practicing family medicine for 20 years, even though she was one of the newer hires into the women's clinic. And so the fact that she did take the time to get to know me, and she was like, if we need a mammogram, we could do it on site and this and that. And I thought, wow, I don't have to run to 5 different offices, because in the civilian provider world, you do. If you need an ultrasound, your doctor's office doesn't do it. You go to they write you a script, you go somewhere else, you wait for those results, they come back. I mean, it can be very time consuming and lengthy. And the VA, I didn't have to, kind of checked
You
all the
want to say
boxes.
something?
No, I mean, I agree. My primary care provider is also in the women's clinic. She's amazing, and she does everything. And again, that's obviously we all have our own experiences in the VA, but I cannot imagine doing it. When I went through, I had my daughter. I used my VA benefits for that. And when I did that, I did have to see a civilian doctor because that is not something that we take care of inside of the VA. But the treatment was so incredibly different. with the doctors, the style, it almost like the civilian provider doesn't know you. They don't know your history. They don't have those things to look at and say, okay, I know this person. I've seen this person. So the experiences were totally different. And if I could have had her in the VA, I probably would have had her in the VA.
Someday soon, we'll have enough women at each VA. It's going to be down the road a little bit, actually. But there's 3 sites that we deliver. We have OB care on site up through almost delivery, because we know that it's better to coordinate the care.
Yes, absolutely. Actually, I did go to a VA early on because I was living in a different city before I moved back home. But yeah, so in San Antonio, I did go to a VA for my prenatal care until I moved back to Dallas, where I started with the private civilian provider.
I kind of have a question. So one of my concerns, within the civilian healthcare system, I can develop a relationship with my primary care providers, with my doctors and everything else. If you've had, one of the better experiences, have you been able to establish any of those personal relationships with your with your physicians?
Absolutely. Absolutely. I have a personal relationship with my primary care provider.
Yeah?
She's quite amazing. And I have relationships, at least in some capacity, with the nursing staff on hand. They are all, I think all but one is a veteran in my hospital. They're phenomenal. When you walk, especially in Dallas, you walk in and you can see their military photos and their current, you know who they are, they know who you are. I have not had an experience where I walked into my doctor's office and someone did not greet me by name and, talk
Really?
about something before. And I'm not there every day. I used to be. But I'm not there every day. So, yeah, there's definitely opportunity to establish those relationships.
Well, that's a plus.
I would say I had a little bit different of an experience. I got shifted around unbeknownst to me from yellow clinic to green clinic to red clinic through some administrative changes that I think had nothing to do with me, just patient load. And now I've been switched to the women's clinic. I have seen the same primary care repeatedly and the same mental health doctor repeatedly for the past 3 or 4 years, because when you call for an appointment, you can request and they can actually access that specific provider's schedule. And of course, if you need something more urgently, you kind of see whoever is first available. And I don't know the desk clerks or any of the nurses, but I will say it's always clean and they're always friendly, and that goes far enough for me.
That counts for something.
So what about your experience? What is it you'd be looking for?
Well, I guess I would want to see something mirrored to what I get on the civilian side. I don't want to just be another number. I want to be, somebody, I want to be greeted professionally and be treated like a real person. And I'd like to be recognized as a female vet, not walk into a center and have somebody say, are you here to see your dad, or, or are you here for your husband? Or
What's your
something like that.
sponsor's last four?
Exactly.
Is the question
It's
I
like,
used to get.
You want my last four?
And I used to say, I know I'm young enough to look like a minor, but, no, I look like a minor, but I actually haven't been asked that in probably 10 years. I don't know. Did they ask you that in Dallas?
They did. They did early on, but I look young, and I like to tell people I wear Uggs and sweats and stuff like that a lot. So I tend to look a little young, but not really. Not really, but then my experience, too, is I'm pretty well known in my VA.
Well, it's admittedly an issue. We've been having culture change campaign, as I call it, for quite some time. It's been one of the major efforts from my office to put up posters saying, she wore these, she served too. Women veterans pins like you have on.
Oh,
But it still can happen, and it's one of the things that is really, it hurts me to hear about it because it can happen, and we need women veterans to continue to be there and to speak up. I think as we get, sometimes it's almost been a critical mass where the clerk keeps seeing people come in and say, well, I'm a woman veteran, but it shouldn't have to be that way. It shouldn't have to get to the point where you've seen enough, so now you say it might be a woman veteran, but rather their first thought is, well, of course she served,
Right.
and then she can correct me and say, no, I'm here to see somebody's mother or father.
I think that would definitely be ideal.
Yeah, it's a training issue. It's a huge issue in the VA, though, because
Well, it's
Well,
a
we
big
have it in-
organization.
Yeah.
So.
I know, it's in the military, it's, system-wide.
Well, plus you think about the demographic of the VA. So the normal demographic up to a certain point was an older male population. And when there was a female veteran that came in, she was not bothered by the fact that they asked who her sponsor was, because there weren't as many that were coming in at one time. So I think it's understandable to a certain extent that things were that way. They are changing. People now, in my experience, don't ask that question anymore, just because whether or not I look like I'm too young or whatever the situation is, they know now that there is not a face of a veteran. Veterans are so broad and diverse, and you just can't look at a person and assume anything. You have to really stop and say, okay, are you a veteran or do you have a sponsor? I don't get that anymore. And so that's a major step in the right direction, in my experience.
Yeah, it's definitely.
It's certainly respect and wanting to know that you're going to be respected for who you are and that you serve.
Absolutely.
Your service is respected. I want to talk, you mentioned a moment about the vet centers, and I think I want to just tell a little bit of information about the vet centers because there's some misinformation. Vet centers are part of VA, and they grew up for folks who felt kind of on the outs after Vietnam. Their Vietnam veterans kind of populated the vet centers. But the vet centers are mostly, they're all out in the community. They're like in strip malls. And they are set up as a counseling center for veterans and family members. And they have a lot of services, including family supports, job hunting services, lots of counseling. They have military sexual trauma counseling. One of the most unique things about the vet centers, besides the fact that there's not a charge to veterans, of course, is that their records are 100% free from being sent to anyone. No one can get the records from a vet center. And so they're particularly good for people in the reserves. It will never be
Yes.
part of your medical jacket. It's particularly good for folks who are just feeling like they really don't want anyone to know, but they really need some help and some counseling. And so it's a place for veterans who otherwise might feel that there isn't a place.
Right.
And they're under Vet Center on the web. You can find them in lots of ways. They're in the phone book. And, there was a whole series in Doonesbury about the vet centers, I think, because it helped people realize that they really are an alternative. They're part of VA. They can help you get in other kinds of VA benefits if you want. They can lead you through all of that. They also can help people who had a bad discharge paper. And I know our veteran service organizations can also help with that, but if you have nowhere else to turn, vet centers are a place that if something went wrong and you got bad papers, you have trouble getting other benefits, but they can help see whether that can be reversed for you.
Do you have to be enrolled in order to
You do not have to be enrolled.
just stop in with your
Just
car?
go there, and they will help tell you what they can do for you, and they can help direct you to other parts of VA.
Perfect.
Eligibility for everything in VA, I think, is kind of complex. And so I always say to people, go, call, make the phone call, stop by. People will always be able to tell you if there's something that you're not eligible for, but you'll never know what you can get from VA.
Right.
Until you ask.
And most people who've served, either been deployed or served 2 years active duty or had other things that qualify them. You served in the armed forces, active duty military, deployment, combat, you're probably eligible for most of what VA offers, if not all. And we want to encourage people to just try. Call the 800-855-VA Women, but learn about your benefits. Some of the things I didn't know early on were all things like the home loan guarantee. Benefits for survivors, benefits, my mom was eligible for a while before she passed for some benefits related to my dad's health care. So we don't always know everything that everyone's eligible for, even if we're kind of in the system a long time. So we're going to see, are there other questions that you wanted to ask each other? You had a good question for the others. Was there something else?
I don't have a question right now.
Okay, all right. I wanted to tell the audience a little bit that VA didn't start this thing today. We actually were approached by a group of women veterans who wanted to talk about VA care, in part because of the large number of, I think, negative perceptions. I think somebody's have to put that on the table. The media lately has exposed a lot of problems. And I think people, maybe you must have heard some of those stories. What do people say?
I have heard some stories. I saw some pretty rough articles, some reports that have come out. There's a recent ID report that came out that was definitely not pretty. I think from my own perspective, it's, it's easy to say that, the VA is, jacked up and they've got all these problems, they don't care, all of this other stuff. But, at the end of the day, that you have to think, one, we're all human. Two, it is the government, and three, it's part of the government. So all of these, reports that come out are going to come out, where they might not come out on the civilian side. So it could be, just the nature of the system.
It's a huge system. I think people don't realize we have 151 hospitals and over almost 800 outpatient clinics. It's huge to run this system, and there are holes in it,
Right.
as well as there are places that are being run well.
Well, but also, Dallas has had its issues, but we have recovered greatly from them, and for the most part, I'm sure there are still some issues, but we're doing a really good job of pulling out of that. But also, like you said, I mean, it's the government that you're talking about, so there are so many things that go on in the civilian sector with regard to medicine. I have a lot of friends who are doctors who would not want to talk about a lot of what's
Their
going on,
failures.
right? And they don't have these major reports that are going out nationally
Right.
to people to highlight what's going wrong with them. But trust me, it's if it's not the same, it's probably worse because they're not as strictly regulated as a government entity would be. So there are a lot of good in the civilian sector, but there's a lot of good in the VA. And I think when we have those bad experiences or we hear something negative about the VA, it's important that you don't just take someone's word for how horrible the VA is. I think it's necessary that we go out and we experience it for ourselves before we can come to a conclusion about what's right for us.
Absolutely. And I think from my perspective, I think what's more important is seeing the VA make those steps towards changing those negative perceptions that are out there, embracing the technological world and having, things like this where, you let us come up here and we just ask questions and talk and, and be able to.
Well, and I'd add, if you don't like your civilian provider, you really have no recourse. Because if you call your health insurance
True.
company and say, that exam was horrible, they say, okay, go see another doctor. And inside the VA, they do have patient advocates. There are people on site that you can make reports to. And they are people that ask questions. Were you satisfied? Did you have a good visit? And you don't have that recourse in the civilian population. So for every good, I always say for every 5 attaboys, 1 bad report takes those away. And it is sad that the VA doesn't get the credit for being as large and having, I think you mentioned earlier, the highest patient satisfaction ratings.
And we have them, but we have this huge challenge. So how can we get anyone to sort of believe that some places are good, or maybe even maybe you can't believe everything about VA, but what about this idea? What about those folks who came to the VA before and had a bad experience? What would you say to them?
I say keep coming back. So I was telling Amelia, she said, well, what do I do? And I said, the first thing is you can call 800-827-1000 if you have general benefits questions, or call the 855 VA Women. But if you get somebody that doesn't satisfy, hang up and dial back, because just like civilian healthcare providers, sometimes you do get a rep that doesn't have all the answers or isn't willing to give you the extra information. But for every person that was kind of short or couldn't satisfy my curiosity, I have had great ones. I had a lady with the VA Choice program, who stayed on the phone for 25 minutes, going step by step and explaining to me exactly how the system was working and why I was not getting an appointment that immediately and what they were waiting on.
Right.
And I was so appreciative for the information, because the frustration a lot of the times is what kills the desire to keep going back if you get frustrated over and over again.
Plus, the people who work for the VA often have some personal connection to military. They have family that was prior military, they themselves were prior military. So there is a degree of ownership that goes into what they do, and they care a little bit more than someone on the outside who really is just kind of there to do a job. The answers that they're given, they probably have had to look up for themselves or someone close to them at some point. So the experiences are just different. And again, I have very little experience outside of outside of the VA and the Army healthcare systems, but I have been exposed to the civilian medical community because I do have relationships in the civilian medical community. So I'm not speaking from personal experience in that I had a horrible civilian doctor, and that's just not the case. It's just I talk to a lot of people, and I have had so much experience in the VA that it's just important, like she said, like I said before, just keep going.
Just keep trying.
And we
keep
still have
trying.
that group, women from Vietnam era, women who are older, your mom, what's going to have your mom think about going to the VA for any benefits?
She's still Department of Navy. She runs a family medical clinic, so she feels like she already has enough medical experience to treat herself. No. But I was saying to her, we're from Camp Lejeune, and there's a toxic water, and so I was explaining the new laws and some of the healthcare benefits. And so she'd had breast cancer years ago, and I said, now, you would have been eligible for 100% of that care to be covered, and that was very expensive. I mean, she did radiation every day for 5 or 6 weeks, and that was time off of work and co-pays, and you have to pay for the radiation, and then it makes you really sick. And I said, all of that would have been covered by the VA at no cost to you. And so it really benefits you to enroll and to ask the eligibility questions, because the cost, healthcare is going up. It's our largest economical purchase apparently nowadays. I think the recent study came out and said it's like 40% increase year over year.
Right, and if you don't know, then just ask. If you're not sure if you're eligible, call the hotline, do the eligibility questionnaire, ask, because there are so many, and we don't know right now what's going to happen to us next week or next year. So anything could come up, and you don't want to wait until something horrible happens or something very serious comes up, and then you think, well, I need to see if I'm eligible for the VA. It takes so little time to get it done now, and then if something does happen, you're already covered and you're okay.
I was saying I got a new VA ID card because I had one of the old school ones with your social on it, and they have a new one. I guess it's a couple years old now. So I went and I scheduled a whole hour and a half because I thought, I'm going to go. I'm just going to sit here and look at the wall and wait. And they had me in and out in like 10 minutes. And so I had time to go down to the canteen and have a cup of coffee before my appointment. So they are getting much more efficient.
Maybe you want to talk a little bit. You mentioned Voc Rehab, and I think people don't know really what that means or what that might be.
So if you're 30% service-connected disability or greater, you're eligible to have your college expenses paid for, and then you get a monthly living stipend. When I went, it was about equivalent to the GI Bill. So the money, I think it was $800 or $900 a month at the time, so this is going back a decade. But you get all your medical coverage and dental, and at the time I had a couple of cavities, and so those are very expensive to have treated if you have no insurance at all. The VA got me in, they took care of it right away. And I had all my general medical, physicals done for the 3 years that I was in school with very little fuss. And again, those records still exist. Repository, that's the word we were looking for earlier.
One of the things the VA does have are some of these kinds of items for veterans, like career counseling, figuring out what college skills you might want to get, how to get your college paid for. And we talk a lot about healthcare, but I think sometimes women don't realize also that it's a way to kind of blend all those issues about what do you want to do as a career and how you can go forward.
I had a wonderful career counselor, I think, in DC, who sat down and said, honey, you're not reaching high enough if you're just going for an associate's. And I said, well, I thought that was all I could do. And he said, nope, we're going to write an educational plan, and here's how we're going to kind of formalize your goals, and you should really strive for a bachelor's. Like, if you're going to start the program, kind of aim for the next level. And I said, okay, I was 22. Sure. But it was actually great because it made me not take classes. All the classes that I took counted towards my bachelor's. And so when I hit 24 and I said, well, yeah, bachelor's kind of the thing to do, everything counted. And so I'm thankful for that advice. And then also very helpful, when I finished my bachelor's, I had 2 months of educational benefits left, and I was they paid me for those 2 months because I was seeking a job. And so even though I was graduated officially, because I had that benefit left, I still received that funding, and it was wildly helpful because I wasn't eligible for unemployment and I didn't have another income stream at the moment. And so that cushioned me into getting my first job, my first paycheck, because that's a 3 to 6 week.
Yeah, it's a long time.
Also, I went through graduate school on my VA benefits, so I think sometimes people have this idea. At least I've heard from people in my life that, well, they'll pay you through your bachelor's degree, but that's about it. Like they won't do anything beyond that, and that's just not the case either. I went through grad school on my Voc rehab.
Yeah,
and
it's 48 months of benefits. So if you
And,
can get a master's degree in 48 months, they'll pay for it.
And so it worked out. It worked out really well. So I think it's just really important that you investigate what's best for you. You don't take someone else's experience and think that, okay, this is what I'm going to do and plan based on someone else's experience. That's not realistic. But investigate where do you want to go and what is it that you're trying to do, and talk to your VA resources, and they'll be there for you and they'll walk you through it. And I had a great coach as well, and she really did push for me to come through. And there were so many other benefits that came with Voc rehab that I just had no clue. I had absolutely no clue.
Well, they pay for your school supplies. I think that that doesn't seem like a big deal, but when I had a $745 book bill, and I was at a loss as to how to pay for that, and they said, well, just send us the receipt. We can reimburse that. And
Yeah.
just the pressure that took off of me. I didn't have to take out a student loan or beg, borrow, and
Right.
plead for the money, because it was $745 a quarter.
And at my school, we had an account set up, so I didn't even have to pay anything. There was just an account already set up. You just go in, tell them what you need, give them your syllabus. They give you your books, pencils, paper, erasers, and a laptop. And
Oh, I didn't get a laptop. I did get a really nice scientific calculator.
And they are talking about something that you need to be service connected for the full amount of the benefits, but there are many other vocational counseling and other services that go along with the education services that the VA has. So we've covered a lot of ground here, and one of the things I wanted to do was turn to the audience, and we have microphones set up. It's now a time for you to be able to ask our panelists questions that you may have about their experience, or just what they think about care, about being a veteran, while somebody comes on up.
Okay, I'm going to go ahead and start. You've done a wonderful job there. Can you describe, help visualize, what do you see when you go into a medical center now for the women's side of the house? Is it you're mixed all in with veteran population? What does it look like?
So in DC, we have our own waiting room, we have our own area, and they've just recently opened the Women Veteran Pavilion. So we actually have our own kind of pretty little garden spot also. It is segregated, and they actually ask you when you walk in if you would like a witness with the doctor. So if you're not comfortable being in one-on-one with the doctor, they'll ask a nurse to come in. And so it's just like walking into a private doctor's office. It's its own little enclave.
Right. In our situation, it's the same. It is a private waiting area. You don't necessarily have to segregate yourself because as a veteran, I mean, sometimes you want to mingle with fellow veterans, and they're not all just females. But there is the option to sit separately. It's very welcoming. It's very warm. And it is like a private office in our situation as well.
It is one of the things we've worked on at places that it felt like walking the gauntlet to get into the VA, and literally having to go past guys that were sitting there catcalling and, saying things. And we really have tried hard to change some of those structural things about the VA.
It's funny because the last time I went to VA, by the time I made it to the doctor's office, I was exhausted from people saying, "Hey, how are you? How are you having a good day? Hey, welcome to VA. Can we help you with something?" And I was like,
Too welcoming.
yeah. Just I'm trying to get to my appointment.
And we have another question.
Yes, Tom Berger from Vietnam Veterans of America. Do you have any suggestions as to how you can recruit older women? I mean, my generation of veterans to use the VA for the first time, and in some cases to come back where they had a negative experience because the system was different.
I would say one, VSOs. They're going to be primary vehicle for getting that information out. Secondarily, through social media and then through other veterans. The veteran community is so small that it's so easy for us to, just communicate with each other. Danielle and I have known each other for a while, and we met through just different panels and stuff that we had talked on, and, and just
Stayed in touch. Right?
that's just the way it goes,
So we have to be responsible, I think, at some point for spreading the message. And I do think our generation has kind of stepped up to say, like in the case of my mom and her friends, if you're not registered, it's your fault, not ours.
But I also think that in our situation and in this generation, it's easy to do the social media thing. We can all connect very easily with the social media, and the VSOs are outreaching to our generation. But you were asking specifically about the older veteran community, and I think it's just very important to embrace this generation because we are doing so much actively to kind of pull ourselves together. If the VSOs decided to host an event that embraced this generation and also that one, it would be a good way to network and communicate and pull things together and establish those relationships. Almost like, in my daughter's school, they have a program where the little ones, because she's 4, and the high schoolers have to deal with each other. They have set programs where there is a classroom elder, that elder being a senior classman. And when I walk in, or my daughter walks in at 4 years old, she's got friends who are seniors and juniors in school that are calling her name and just seeing how she did over the weekend. So I think something similar to that really would benefit that older community.
So a buddy system. We need to
Almost.
go back to the buddy system
Yeah.
then.
Yeah,
And
I
I think
think
there's
so.
a lot to be learned on both sides of the coin, right? I mean, they trailblazed
Absolutely.
for us, and we kind of came in behind them. And so that relationship is valuable for both sides. We can bring them to social media.
Yeah.
I'm Betty Mosley Brown with the Center for Women Veterans, and we're about to kick off a Women Veterans campaign at 5 sites across the United States, and we have a website, www.va.gov/womenvet. But the biggest question that we get asked is, what do you want to be called? Because we know we don't want to be called him or he. So can you just, each one of you, tell us how you would like to be addressed when you come to a VA facility?
Well, they can address me the way my soldiers do, which is staffs aren't polling. But no, I think I want to be addressed as a veteran. Just respectfully. Just like Ms. Polling. Or Amelia. I'm fine with that too.
I could tell you what I don't want to be called. I
There
don't
you
want to
go.
be called a shiro. I know that was very popular palindrome for some time. And I don't necessarily want to be called a girlfriend. Sister doesn't bother me because generally it's guys that say, you're our sister in arms, like brother in arms, and that is generally okay. But I just prefer to be called veteran. I don't think I'm any better or worse than any other veteran that exists, and so the
Absolutely.
term doesn't offend me.
Yeah, I'm a woman vet.
I agree. I'm a veteran. I don't want to be held differently or stand apart from fellow veterans. I don't think that I've done any more or any less in the grand scheme of things. And so it's important that you or that people recognize just that I did my time. I sacrificed what I could, and that I'm a veteran, period. Being called a veteran is an honor. And I don't think that should be stripped from a person just because she's a female.
Absolutely.
It's pretty powerful.
Thank you for your service. I'm Renee Campos. I'm with the Military Officers Association and also a female veteran. I wanted to go back to the discussion about navigating the VA system. My experience working in the advocacy area in a military and veterans organization, and even on active duty, when we talk VA, we talk VA, and most people associate that with the healthcare system, or they may, associate it with disability benefits or whatever the case may be. But I'd like to know your experience and those people that that you might have served with, or people that you talk to now, in terms of, do they really understand that within the VA there's 3 large administrations and that they are interlinked, whether they may appear to be or not, but, and do you think that might be an area that, we can work on a little bit better to, educate women veterans to understand that linkage?
So I would say that one of my biggest pet peeves is that when I say to people, they say the Veterans Administration, and I say that doesn't actually exist anymore. It's been Veteran Affairs for, I think, almost 2 decades now, a long time. And underneath Veteran Affairs, there's the benefits and the health care. And from my experience, most people don't actually realize that those are individual entities with their own leadership structures and their own mandates. And more or less their own systems. So from my experience, the systems don't overlap and communicate very well. A really good example is the VA Choice Program pulled an old record of mine from somewhere, and they left a message for me on a phone number I haven't had for 12 years. And so I missed the appointment because I didn't get the message, and obviously it was a kerfluffle all the way around because their systems were not updated internally very well. So I don't think that people realize that A, it is 3 distinct entities, and that B, that the entities sometimes aren't on the same page.
I agree. I don't think that people, specifically, I don't think that people recognize that they are definitely distinct. They have their own separate operations going on, and maybe if we outreached a little more about what each entity was doing and where we were going with it, then the understanding would be clearer. And I think people's embracing, right? They're embracing those different entities, and the perception of each would
Well,
change.
and I think you also don't know what you don't know. I think if you don't know the question to ask, I mean, I was enlightened today. I was under the impression that Arlington Cemetery belonged to the VA, and it does not. It belongs to DOD, in case anybody didn't know that, to the Army. And so there's always more information to be had. And if you have no idea, if you don't know what question to ask, then it's almost impossible to get that answer.
I would completely agree with what both of you guys have said. It just, it's all about communication and communicating not only between, the different entities within the VA, but also with the general public and with the veterans that are out there in the services. I used to work for the National Resource Directory, which is actually on e-benefits, and it connects, veterans, service members, military and veteran communities, with all those services that are out there to support them. And it wasn't until I started at the position that I actually even knew what I did, like that I could find out what I
existed, yeah.
did about the VA,
Right.
So that
It's
was my
hard to
little
find
plug.
things. And the one thing that didn't get mentioned actually is the National Cemetery Administration.
Yep.
And people don't want to think about death and burial, but it's a very real part of life. And now the VA has ways for people to pre-plan. So people like my dad, he's 88, he gets to sign up for some of the things that he knows he wants as part of his burial and having a military burial. So we don't want to think about that a lot, but it's part of VA benefits as well.
I think that's really important too, that we take that and really think about that. My dad was a veteran as well. He passed away recently, and he just refused to address that issue. And I'm not a morbid person by any means, but I am a realist. And so I was like, hey, let's talk about burial, and let's talk about. And he was like, no, I'm not going to talk about that. He's like, I'm absolutely not going to talk about that with you. But I think, it's important that we take all those things into consideration. And like you said, if you don't know who to ask, or if you have a question but you don't know, you ask it to the wrong entity, you may or may not get an answer. So
Get the entire answer.
yeah.
Well, hopefully we're getting to some more streamlined ways to get information. I was wanting to make sure whether there's another chance here for a question.
I'm back. I think we must talk a little bit about the unpopular subject of military sexual trauma and how can VA help?
Well, I'm certainly willing to talk about that a little bit. We now know that about 25% of women who served had an experience of severe sexual harassment or sexual assault. And I'm sure, without asking you, I don't want to ask you if that happened to you, but I'm sure you know people. And the VA does have, as I mentioned before, if you were sexually traumatized, you can come to VA. You do not have to prove it. We're talking about VA healthcare and counseling, either at the main hospitals or at the vet centers. There's no proof required. Just say something bad happened to me, and we will have you have counseling, and any medical care related to that. And frequently that you're also eligible for other kinds of medical care. And whether you were on active duty for training or you were just doing a drill weekend, we now have the authority to treat someone even if they were not a veteran in the other sense of the word in terms of something happening to them. So that's, I think, in some ways what VA wants to be sure to offer is no matter what, come to the counseling services.
Well, and I have to say, I think that they, in the past several years, have been very proactive about it, because
Yes.
as I was kind of switching from clinic to clinic, every time I was kind of being in process, they did screen me. You know, did you experience this? Did you experience this? I think it's 4 to 7 questions, and then there's also a PTS screener, and I was kind of confused, like, why are you, oh, you're just the clerk, why are you asking me these questions? And he's like, because we want to make sure that we have the answers. And I said, oh, that was a good answer, okay. It's like, just in
Well,
case, in
we
case you
screen
don't
everyone who
volunteer.
comes in, men and women both. We know it happens to men as well. And we have expert counseling. The good news about the counseling is that we now have proven types of counseling that once you get in and start working with therapists, 10 to 12 sessions, you can actually get your memories to a place that you can live with, you can get on with your life, you can work on things individually or in group, and oftentimes kind of move on to some the other things that are all impinging on that issue that has happened for you in your life. So military sexual trauma is an issue that is very much part of our care in the women's clinics as well.
As a service member, like as a current service member, I would say that one of the things the VA can do is start communicating those services to the DoD and down to the services. You know, because if it's not reaching at the service member level,
Right.
you know,
And
then
the latest change is folks can come to the VA from DOD without telling DOD. That's just getting worked out, but it will be a way for people to seek care. We have another question?
It's okay.
Oh, but we want to be able to bridge that gap. We want people to realize that the VA isn't DOD, you
Right.
know, and that's the other thing about it being Department of Veterans Affairs. We are not DOD, and that's really important for transgendered individuals, for lesbian and gay individuals, for folks with trauma, and for bad things that happen in the military. The VA is not DOD, and you can get safe and complete treatment in VA.
yeah.
Without fear of repercussion, yeah.
Without fear, and it's not going to be, not going to be part of your record over in DOD. The records are really more one way. We're getting the health care from DOD. DOD is not getting the reverse.
I think that's a very important
That's-
Yeah, it's
point
important.
to make.
Because people may go back in. I mean, I know any number of people that I met over the years that even changed departments. You know, one that was Army, didn't want to be deployed again to Iraq, so she went into the Navy. My family's all Navy, and next thing we know, we have her CB pictures with a 60 cal. And so it didn't quite work out the way she wanted, but now she's a Navy veteran. So a lot of things can happen.
That's funny.
So I think we're about at the end of our time, and I appreciate everyone coming and being so involved. I especially want to thank you here on the panel for being great volunteers and really wonderful in terms of volunteering the information about your lives.
Well, thank you, Dr. Hayes. You've
Thank
been,
you for
it's
having
what,
us.
30 years of service, so we
I've been
appreciate it.
serving the VA, yes, serving the veterans. I wouldn't have a job if it weren't for you veterans. So that's what my life is about. Thank you all.
Thank you.